Hello everyone, I am Dr. Solanki. Welcome in my YouTube channel Radio with Rohit. Today we are going to discuss one very interesting and important topic, venous system of brain or intracranial venous system. So, stroke. A stroke can be because of either the ischemic cause, so ischemic stroke, or hemorrhagic stroke. Hemorrhagic stroke could be because of venous occlusion, subarachnoid hemorrhage, or spontaneous intracranial hemorrhage. We are today more interested in venous occlusion. So, intracranial venous anatomy is divided into the two subtypes. First one is superficial venous system, second one is deep venous system. So, this is our line diagram of our venous drainage, intracranial venous drainage. This line represents the superficial or the superior sagittal sinus. This is the vein of the trollard which is draining into the superior sagittal sinus. This is all inferior sagittal sinus. This is the thermostriate vein which is draining into the internal cerebral vein which is drained into the vein of the Galen which is draining into the inferior sagittal vein. I am repeating it. This is a thermostriate vein in green color. Orange color is our internal cerebral vein which is draining into the great cerebral vein or vein of Galen. Now this inferior sagittal vein and this vein of Galen is forming the straight sinus. So this is our superior sagittal sinus, this is our inferior sagittal sinus which is conflicting with the great cerebral vein and forming the straight sinus. This point where the straight sinus and superior sagittal sinus are meeting is termed as the torcula. Then it forms the transverse sinus. One vein of the labe is opening or draining here in the transverse sinus and making it to the straight, the sigmoid sinus, and it is draining into the internal jugular vein. Here we can see that this is our superior sagittal sinus. One vein, superficial vein, termed as the trollard vein, is opening in the superior sagittal sinus. This is our inferior sagittal sinus. Thermostriate vein draining into the internal cerebral vein, which is draining into the vein of the Galen, and this inferior sagittal vein and vein of the Galen forming the straight sinus. This point is our trocula, and this point, after this point we are termed this to the transverse sinus, after this sigmoid sinus. This cavernous sinus is draining into the sigmoid sinus with the help of the petrosal sinus. Here we can see that this is superficial cerebral veins. These are the multiple superficial cerebral veins which are draining into the superior sagittal sinus. This is our superior anastomotic vein or the vein of the trollard. This is the inferior anastomic vein or the vein of the labe. This vein of the labe is opening into or draining into the transverse sinus, while our vein of the trollard or the superior anastomotic vein opening into the suprasagittal sinus. Here the deep system, the facial vein and the ophthalmic vein here, these are draining into the cavernous sinus. Cavernous sinus on the both sides are connected with the help of the intercavernous sinus. This cavernous sinus is draining into the internal jugular vein with the help of the inferior petrosal sinus and draining into the transverse sinus with the help of the superior petrosal sinus. I am repeating it. Ophthalmic vein and the facial vein are opening or draining into the cavernous sinus. These both sided cavernous sinus are connecting with the help of the intercavernous sinus. Its cavernous sinus are connecting or draining into the internal jugular vein with the help of the inferior petrosal sinus, and they are draining into the transverse sinus with the help of the superior petrosal sinus. Here we can see that this is our septal vein, this is the choroidal veins, thermostriate veins, and internal cerebral vein. So this internal cerebral vein is draining the septal vein, choroidal vein, and thermostriate veins. These both internal cerebral vein confusing together and forming the great cerebral vein or vein of the Galen. So this is our final diagram. Here we can see that deep cerebral venous system and superficial cerebral venous system are together demonstrated in this diagram. This is our superior sagittal sinus, this is the inferior sagittal sinus, this is our now this is our straight sinus and transverse and sigmoid intrajugular vein. Here we can see that these are the area which is drained by the particular venous sinus. So this red area which is covering most of the part of the brain, this red area is draining by the cortical veins or the superficial sagittal sinus. So this is by the superficial sagittal sinus. This yellow area is drained by the sylvian sinus or the sylvian veins, and this green area is by the vein of the labia which is then draining into the transverse sinus. I'm repeating it. This red area is draining by the suprachiasmatic sinus. This yellow area by the our spinoparietal or the sylvian sinus, and this green area by the vein of the labia. So, when to think of the venous thrombosis? So, etiology per se, there could be any systemic cause or any coagulation pathology, local cause like the mastitis or the CSOM which leads to the thrombus, any trauma which leads to the thrombotic condition. Clinical complaint patient will end up in our department with a complaint of the seizure, headache and loss of the consciousness. This is will be the usually a young age and a female who is taking OCP pills. So modality for the venous examination, we have the particularly two modalities. First one is CT scan, second is MRI. CT scan, we can do either non-contrast CT or the CCT. On MRI, we can perform TOF MRI or non-contrast MRI or contrast enhanced MRI. In between the TOF MRI, we have two options, either 2D TOF or the 3D TOF. So, best modality among all four is our contrast enhanced MRI. Then second one is MRI TOF, then CCT, and at the last we have the non-contra CT. This is the sequence. This is the more specificity, this is the low specificity for the thrombus. So when to think of the venous thrombus, we have the direct sign of thrombus. There will be dense clot sign, cord sign, empty delta sign, loss of normal flow void on MRI. Venous infarction, there will be mostly bilateral, temporal lobe infarction, vein of the labia, cortical edema or hemorrhages will be there, peripheral lobar hemorrhage will be there. So, this is a non-contrast CT scan. Here we can see that this area is representing hyperdense region. So, this is our dense clot sign. Dense clot sign is not a good indicator. This is present in only 30% cases of the venous thrombus. In the rest of the patient like with the dehydration or ESR raised or hematocrit value raised, also show this dense clot sign. So this is present only in 30% cases and there is a big pitfall also. So this is also a good indicator for the venous thrombus. Here also we can see that there is a dense clot sign is there. This is also indicating the dense clot sign with the hypodense or hemorrhagic transformation or the hemorrhagic infarction in this temporal lobe. This is the empty delta sign. This is the contrast enhanced CT scan. Here we can see that this hyperdense area with the hypodense area in center. This is because of the recanalization of the venous system after the thrombus formation. So this is the empty delta sign on contrast in a CT scan. Again here we can see that two cord-like thrombotic structure present here in the sinus. So this is our cord sign. Here we can see that here normal flow voids are maintained or the present, but here hyperdense venous channel present. So this is absence of the normal flow on the left side indicating toward the thrombus formation. So with the help of MRI, we can predict the approx age of the thrombus formation. Normally our tissues or the cells has the oxyhemoglobin, so there will be normal flow void present on the normal patient. If thrombus is there in its age is between 0 to 5 days, we will classify it to the acute thrombus, and in the tissue the oxygen will be deficient, so there will be deoxyhemoglobin. It will appear isointense on T1 and hyperintense on T2. If the thrombus age is between the 5 to 10 days, it is classified under the early subacute thrombus. In intracellular, there will be methemoglobin. On T1, it will appear hyperintense. On T2, it will appear hypointense. In 10 to 15 days thrombus age, we will classify it under the late subacute. So this methemoglobin, now there will be lysis of the cell and this methemoglobin will come out. So extracellular methemoglobin will be there. It will show the paramagnetic effect and there will be hyperintensity on both T1 and T2. If this age of the thrombus is more than 15 days, then we will classify it under the chronic infarct and cell will be that. So T1 isointense and T2 will be bright. So again we will revise it. Normally there will be phloid. If it is acute thrombus, then it will appear isointense on T1 and hyperintense on T2. If it is early subacute, then it will be hyperintense on T1, hypointense on T2. Late subacute, then it will be hyperintense on both T1 and T2. And if it is chronic, then it is isointense to hypointense on T1 and hyperintense on T2. Normally, this infarct will shows the blooming effect on GRE or HWI sequence. Here we can see that there is hyperdense area present here in the intercerebral vein region. This is the straight sinus, and here also we can see that in transverse and sigmoid area there is a hyperdense sinus present, while on the left side we can see that phloid is maintained. So this is a typical case of thrombus in the intercerebral vein, straight sinus and a right sided transverse and sigmoid sinus. Here also we can see that thrombosis of the internal cerebral vein will lead to the edematous condition with the hemorrhagic transformation. Thrombosis of the vein of the labia will lead to the temporal lobe, and thrombosis of suprasagittal sinus will lead to the hyperparietal region edematous condition. Here we can see that hyperdense transverse sinus present here. So here we can see that there is an absence of the normal sagittal sinus or here. So thank you so much for watching this video. I am Dr. Rohit.